In this chapter, we'll tell you everything you need to know about the proper diet and exercise plan to help control your diabetes. You'll learn more about the different types of insulin and the oral medications most commonly prescribed to treat insulin resistance. And finally, we'll show you the latest in blood glucose monitoring units and how they are used.
New diabetics always want to know, can I eat blank, whatever their favorite food is?
I love peach cobbler, but I know I can't eat it.
And a lot of times, what I'm telling them is, the good news is you can still have that food, just maybe a smaller portion of that food. Rather than telling someone you need to lose 50 pounds or 100 pounds, it's much easier to hear you need to lose 10 pounds or 15 pounds.
Well, surprisingly, weight loss of even 10, 20 pounds, we can start seeing noticeable difference in blood glucose regulation.
Usually what we recommend is about 10% of their current body weight. So if someone's 200 pounds, that's 20 pounds. Just losing a little bit of weight is often enough to get the diabetes under control. Because diabetes is so closely linked to heart disease, strong recommendations include decreasing your overall fat intake, spacing out the meals throughout the day so that you're not just eating 1 or 2 large meals, but maybe 3 or 4 or even 5 smaller meals throughout the day.
How your blood sugar's doing, your fasting blood sugar.
Obviously, we want to see good control of the blood sugars. If you make the right decisions, then you can maintain normal blood sugars. If you maintain normal blood sugars, the chances of developing any of the long-term complications are much, much lower. So I know people who have been diagnosed with type 2 diabetes, started on medications, started taking control of their diet a little bit, added some exercise, and find that they're no longer needing medications. So let's pick one thing that'll be easy for you to work on for this week.
So for example, going from a large French fry to a small French fry, going from a double hamburger to a chicken sandwich, going from a Coke to water, including more fruits and vegetables.
The most currently accepted and most generally recommended method of meal planning is called carbohydrate counting. So there are 3 main healthy food groups that include large portions of carbohydrates. That's the grain group, the fruit group, and the dairy group. We don't have food labels available to us all the time, so we're not always going to be able to count the grams of carbohydrate in every morsel of food that we eat, and that's okay. As long as you're able to come up with a good estimation, then that's a great place to start. I really do like the carb counting system of meal planning because it does allow for a lot more flexibility. It's really not different in many ways than, again, what I would recommend to anybody who's trying to manage their weight, who has a history of cardiac disease, who's at risk for cancer. It's the way I eat myself and the way I think everyone should eat.